Welcome. Hi, my name is Monika Tortoraitis, and I'm the antimicrobial stewardship pharmacist here at North Kansas City Hospital. I want to thank you and welcome you to this important discussion on antibiotic resistance. So, increasing awareness and understanding of antibiotic resistance is critical, as this is one of the biggest public health crises in the United States, as you can see from the headlines. Unfortunately, antibiotic resistance extends beyond our borders and can be found in all regions of the world. So in the brief time I have with you, I want to discuss some key points surrounding antibiotic resistance. First, I want to highlight the importance of antibiotics, not only to us, but to our families and to our community. Second, I want to review what antibiotic resistance is. How does it occur? Discuss the consequences of antibiotic resistance, and lastly, review how we can prevent antibiotic resistance. So a little bit of history. So prior to the 20th century, the leading cause of death was attributed to infectious disease, such as pneumonia, skin and soft tissue infections, or bloodstream infections. The average life expectancy at that time was in the mid-40s. Now, the turning point in human history was in 1928 with the discovery of what you see, penicillin, and this was by Dr. Alexander Fleming. This was our first true antibiotic. The discovery of antibiotics had an astounding effect on us. For the previously fatal infections, we could now treat with penicillin. It no longer struck terror when someone had an infection. The average life expectancy increased with the presence of or availability of antibiotics, and the leading cause of death shifted from an infection source. So more people perhaps died from heart disease, strokes, or cancers. So the availability of antibiotics saved millions of lives and have made possible some interventions that we may take for granted. For example, surgeries. We can undergo open heart surgeries. We can undergo joint replacements, C-sections. And it also has permitted for patients to undergo chemotherapy. But sadly, Dr. Fleming kind of sounded the alarm in 1945, for he already could foresee that with the misuse of penicillin, overuse of penicillin when it wasn't needed, his concern that this would be a problem and promote the selection of bacteria that was resistant. The first case of penicillin resistance was observed in 1948. 20 years after his discovery of penicillin. Why are we worried about antibiotic resistance? Well, here's some facts. More than 2.8 million antibiotic-resistant infections occur in the United States each year, which attributes to more than 35,000 deaths. Antibiotic resistance can affect anybody, the rich, the poor, at any age, the young, the old, and in any country. How does antibiotic resistance happen? It's a very complex process. But what I can say is that bacteria develop the ability to fight off that antibiotic. They can no longer be killed by the antibiotic. We aren't resistant to the antibiotic. And I hear that from patients. Oh, I can't take it, I'm resistant. When in fact, it's the bacteria that have resistance to the antibiotic. They are no longer killed by that antibiotic that was once very effective. So here's a nice visual effect of what I just mentioned. So the susceptible or sensitive bacteria is depicted by the blue-purple. The antibiotic-resistant organism is outlined in the kind of like the yellow-orange. So you have an infection. I give you an antibiotic and focus on the middle picture. The antibiotic is able to kill off those susceptible bacteria. But by doing this, it allows the more resistant strain, the one that pushes back the antibiotic, to still remain present. The resistant strain can proliferate, or keep multiplying. And this will be the majority of the bacteria there. This is now able to cause a new infection. Where is antibiotic resistance? Can't be here. And unfortunately, it is. It is seen within our community. It can be seen with our pets. It can be seen in our livestock. The other point I want to bring up is that as more and more people are traveling internationally, we can come into contact with antibiotic-resistant bacteria overseas, which then we can bring home and spread to others. Resistant bacteria can be spread between continents through people, goods, and animals. Bacteria, you have to remember this, they're constantly finding new defense strategies. They want to survive the antibiotics that once killed them. The misuse or overuse of antibiotics in humans, animals, and in our environment is accelerating this process. So how does antibiotic resistance spread? I want to take some time on this slide because I think it's very important. So the first thing is antibiotics are like no other medication. If you misuse your blood pressure medicine or your cholesterol medication, you only affect yourself. When we misuse antibiotics, and if antibiotic resistance develops, one can pass this resistant bacteria to others. So we give antibiotics to animals, livestock, promote their growth, prevent infections. If they acquire a resistant bacteria, it can be spread to humans, to other animals, and into the environment. To humans, it can be passed through poorly prepared food. It can be passed to our environment or other type of food like crops through contaminated water by their feces. Now, if we give antibiotics to a person, myself, in the hospital or community, we can also develop resistance, and we can spread that bacterial resistance to other people through poor hygiene or close proximity. So this slide shows you how antibiotics can spread resistance to humans, to animals, and then also in our environment with our crops. What are the consequences of antibiotic-resistant infections? So when you have an infection that I cannot treat you with the standard antibiotics, I may not have an oral antibiotic. You may have to come to the hospital to get an antibiotic through your vein, an intravenous one. Also, these alternative antibiotics may have a safety profile that requires more monitoring. You have to watch your kidney function or your liver function. By using these alternative antibiotics, you may have a longer hospital stay. Your recovery time may be longer. Sadly, despite all of our efforts, the fear is that treatment may fail, and it requires additional modalities to have you recover from the infection. This may also increase your medical costs. Each time a bacteria becomes resistant to another antibiotic, treatment options become more limited. Our fear is that we may counter a bacterial infection where there are no There are no available antibiotics to treat it. Now you may think this won't happen. We have new antibiotics coming through the pipeline. They'll find an antibiotic for me. Unfortunately, very few antibiotics have been developed in the last 20 years. Many of these new antibiotics are variations or modifications of the existing antibiotics. Knowing this, we need to protect the antibiotics that we have, not only for ourselves, but for our future generation. So what can we do to slow down the development of antibiotic resistance? We're doing it here right now. We're having a discussion about antibiotic resistance. But we also need to have judicious use of the available antibiotics. So in the United States, we write more antibiotic prescriptions per 1,000 people when compared to others, as depicted by the slide. More antibiotics are prescribed compared to, say, the Netherlands, Norway, and the United Kingdom. The United States doesn't have more illnesses than others. We simply use more antibiotics, and the concern is we use it when it may not be indicated. Some prescribing facts. So the majority of our antibiotic prescribing occurs in the outpatient setting. Doctors' offices, urgent care clinics, emergency departments. At least 30% of these antibiotics prescribed are considered unnecessary based on the literature that's published. Antibiotic prescribing is the greatest in the winter months. Not surprising, since this is our highest cough, cold, flu season. Now, most of these upper respiratory infections are caused by viruses. Antibiotics have no effect against viral infections, such as the common cold or flu. Antibiotics do not work against viruses. They only target bacteria. So when we take antibiotics when we don't need them, we actually put ourselves at risk for some unneeded side effects. Antibiotics can cause diarrhea, nausea, vomiting, and our biggest concern is promoting bacterial resistance. Simple things that we can do to help protect ourselves. Wash our hands with soap and water. Prepare and cook our food safely, and get recommended vaccines. This will help protect us against some bacterial and viral infections. Now, what do you do when you're sick? You go to the primary care doctors or your clinic to seek medical attention. Now, if they don't give you an antibiotic, that's okay. You may not need an antibiotic, but ask your provider the reasons behind this. Have an open discussion with them. Should you receive an antibiotic, please remember these comments, some safety tips. Don't share your antibiotics with other people. Their illness may not warrant an antibiotic, or if they do have a bacterial infection, your antibiotic may not be effective for that. It actually may delay their care to their primary providers. Don't save your antibiotic for a future. Again, you may not have a bacterial infection, and that antibiotic may not work for you. The same being stated, don't take someone's antibiotic. I do want to have a caution about buying antibiotics overseas or abroad. Be very, very careful. Some of these antibiotics could be unsafe. By this, I mean they could be outdated or expired. They may be diluted or of poor quality, or they could be counterfeit. So just keep that in mind. Some key take-home points as we kind of wrap up this discussion. Remember, Antibiotics are our most powerful drugs used for fighting bacterial infections, not only in people, but in animals and in our crops. Antibiotic resistance, again, can affect anyone, poor, rich, young, old, and in any country. Appropriate use of antibiotics will slow down the development of antibiotic resistance and will help preserve antibiotics for future generations. Everyone has a role in improving antibiotic use. Remember, if we use antibiotics when not needed, we may not have them when they are needed the most. I want to thank you for joining me today in this important discussion. Please see my enclosed emails in this attachment. I am more than happy to answer any questions that you may have. Again, thank you so much.